weight loss programs don't work for everyone.
Yep,
Right?
that's right. Weight loss is probably one of the most common things that we confront as physicians. And, you know, we have a unique approach to weight loss in integrative medicine and an upcoming seminar called Weight Loss the Integrative Medicine Way. And I want to outline a little bit about some of the pearls that I've learned over the years. Now, a lot of my patients are doing everything right and they're struggling with weight loss. They're eating right, they're exercising, they're getting enough sleep, they're managing their stress. Now what, doctor? It's not working.
Right.
That's when you have to look beyond the surface. And that's what, you know, functional medicine or integrative medicine does. And so some of the things that we look at are hormones. That's probably the first and foremost thing. A lot of people hit menopause or when men age and their testosterone declines. That can be why your metabolism changes and your muscles turning to fat and you can't lose weight. Low thyroid is terribly underdiagnosed, and thyroid's your metabolic motor for your machinery, for your metabolism. So low thyroid is a very common reason people struggle with weight. Stress, nobody's stressed out there, surely. But stress and high cortisol. Cortisol is our stress hormone. It will cause fat to accumulate around the middle, and it also messes up your other hormone receptors. So that's a common one we have to deal with. So analyzing hormones is a big component of integrative approach to weight loss. Another thing that's really important is to consider gut health, digestive health, and the fact that most of your immune system surrounds your gut makes this incredible interface. So if people have things like leaky gut or delayed food allergies that they don't know, which are really common, by the way, that can be what's stoking inflammation and stoking high blood sugar and all this metabolic soup, and they just can't seem to turn it around. So things like that are what we look at, you know, from a functional medicine standpoint. And true story, I saw a gentleman yesterday I did some food allergy testing on about 6 months ago because he had joint pains, arthritis. It helped his arthritis, and I hadn't seen him in about 6 months. By the way, he came back for another problem, but he had lost like 40 pounds just from eliminating foods he was allergic to. We see this kind of thing quite a bit, so it's quite striking if you can find what it is for these different people. So we take an approach that looks at these different facets and see if you can uncover those.
So there's not necessarily something wrong with you, okay? There's just underlying things that sometimes
correct,
aren't
and that's what's so rewarding. It's frustrating for patients, but it's really rewarding for us and patients when we can find these things. Now, sometimes patients get pretty far along and they've gotten into a situation where they need a catalyst, they need more help. You know, that's when we may utilize things that we oversee closely, things like the HCG diet, most people have probably heard of. It's very effective, but it's important to identify these other problems, these other factors. These catalysts, I call them, I think are fine. They do a great job helping people lose weight. HCG diet, we use growth hormone stimulants, we use B12 injections. There's a lot of different supplements that can help metabolism or help appetite cravings. There's a lot, so we try and custom tailor it to people.
Absolutely. All right, well that sounds great. And your seminars next week?
Yeah, we have a seminar coming up Wednesday the 20th, I believe. It's a free seminar as always. It's on integrative medicine approach to weight loss, so if anyone's interested, I encourage you to join us.
All right, and there's the info right there on your screen. We'll be right back after the break.